Welcome to our channel. Today we are going to talk about fertility massage and pregnancy. Infertility treatment using massaging. What is a fertility massage? Mu video yaffe ya leero tugenda kwogera ku kigambo oba ekibuuzo ekibuuziddwa omu ku ba viewers baffe ku eno channel batubuuziza nti twogere ku fertility massage. Fertility massage esobola okuyamba okufuna olubuto. Can fertility massages help you to get pregnant? Gerard Massa, the health educator, is the name of the channel, and we are going to talk about fertility massage. First of all, fertility massage does not make you to get pregnant or does not treat infertility. I will begin by talking about this as a caution. Fertility massages tezisobola kuyamba kufuna lubuto naye ate zisobola okuyambako okubanga kwegamba zi increasing chances zo ezokubanga at least ebintu ebirala katugezenga treatments ezokufuna lubuto zikola obulungi. Fertility massages specifically will not treat infertility, but they can help you to actually increase blood flow to your womb, increase blood flow to your uterus, which is a key factor in helping you actually when you go for the medications or when you get treatment for infertility itself, then your chances of getting pregnant will be actually improved. So fertility massage does not treat infertility, but it can help make your womb ready for the treatment to work very well. Basically, it optimizes your womb, it optimizes your system, it improves blood flow to your uterus, but specifically fertility massage alone does not treat infertility. Omu kuba viewers baffe batubuuza ne bagamba nti twogere ku fertility massage oba esobola okujjanjaba infertility oba obutazaala, era fertility massage tejjanjaba obutazaala, tejjanjaba infertility, naye ate esobola okuyambako omusaayi okubanga gweyongera okubanga gugenda mu system yo. Omusaayi guno guba gweyongedde nene kiba kitegeeza chances zo ez'okubanga okozesa eddagala erya infertility tijja kuba likola bulungi. So if you've been asking yourself whether fertility massages do treat infertility, the answer is that they do not treat infertility, but they specifically improve blood flow to your womb, and then also they do help in relieving stress, just like you do yoga and just like you do meditation. They are good, they allay anxiety, they relieve stress, actually, because in most cases, you may realize that you are not getting pregnant because of excessive stress. So they handle the signs, or they handle the stress, they relieve the stress, and then also they basically bring down the stress hormones so that when you get the fertility treatment itself, either through IVF and embryo transfer or through the oral tablets, for infertility like Clomid, then when you add fertility massage with fertility treatments, then you'll be able to get pregnant. Oba oyagala okubanga fertility massage okukolera obulungi, then olina okubanga ogikombininga n'obujjanjabi obw'omusawo bw'agyokuwa mu ddwaliro. So for fertility massages to work very well, you specifically need to add it with conventional mainstream fertility treatments. You need to see your doctor, begin on the medications for infertility, basing on what type of infertility do you have. Probably because there's primary infertility and secondary infertility. So you get your doctor's treatment and then you add on the massages at your massage parlor, and then specifically the person offering or the staff offering the fertility massage, doing the fertility massage, should be qualified in doing the fertility massages, because not everyone can do the fertility massage. Thank you, my friend, for joining me for today's lesson. Remember to subscribe so that you do not miss new videos we release every day. On this channel, we do talk about fertility. We also create awareness about fertility, we do talk about reproductive health and the ultrasound scans. Remember to subscribe so that you do not miss any new videos. Remember, you can also advertise your business on our channel so that you reach targeted traffic. Webale nnyo okujoininga channel yaffe eno, webale nnyo okunyiga epeesa erya red okusubscribinga, era mbuuza ebibuuzo byonna by'oba olina nja kuba mbiddamu, n'ekirala osobola okulanga business yo ku channel yaffe n'oba nga ate osobola okutuukirira abo bennyini b'oba oyagala mu business yo, more especially oba oddiringa ne women's health oba eddwaliro likola ku by'ekikyala, langa business yo ku channel yaffe. Oba oyagala kulanga business yo ku channel yaffe, connecting nange ku WhatsApp yange tubeere nga twogera ku emiwendo gyaffe giri very affordable. Olunaku olulungi Omukama atukuume. Have yourself a fantastic and healthy day, and may God bless us all. Let me answer all your questions. If you would like me to do a video about that question that has been troubling you, you've been trying to get pregnant but you would like me to talk about what you're going through, you want me to talk about anything in relation to fertility, in relation to how you can get pregnant, ask it down below in the comments. I will see it, answer your questions, and even do a video about your question if you are okay with it. Specify that you would like me to do a video about it. Have yourself a fantastic and healthy day, and may God bless us all. Bye-bye. AMH. What is the anti-Mullerian hormone? Have you done the fertility test and your report has come out and the results are showing your AMH levels being low or being normal, or your anti-Mullerian hormone AMH levels are very high? Fertility testing. In this video today, we are going to learn about a fertility test, also known as an AMH levels, or an anti-Mullerian hormone test. So stay with me. We are talking about the anti-Mullerian hormone in this video. Without further ado, we shall begin straight away and talk about what is an anti-Mullerian hormone. After this short break, we are going to talk about all this. After this short break, don't leave. Thank you, my friend, for staying around. We are talking about the anti-Mullerian hormone, and specifically the anti-Mullerian hormone, or the AMH fertility test, is a test which is very key in determining what could be causing your fertility, your infertility. So, without further ado, we are talking about the anti-Mullerian hormone. The anti-Mullerian hormone is a hormone which is produced by your follicles. Specifically, when we take a look at an ovary specifically is having what we call the follicles. The follicles are those reserves which store your eggs. So whenever your eggs are growing, whenever they are in the early stages of growth, they are going to release a hormone. This hormone is known as the anti-Mullerian hormone. The anti-Mullerian hormone can be measured using your blood test. When your doctor wants to determine how your ovaries are, how your fertility state is, then your doctor is going to request for a test on your anti-Mullerian hormone levels. The normal anti-Mullerian hormone levels are between 1 up to 4 Ng per mil. So if your report comes out and you have an AMH level of at least 1 or 2 or 3, then it means you are having normal AMH levels. But if your report comes out and you have 0.2, then it means your anti-Mullerian hormone levels are very low, and then there are high chances that you could be having also very low ovarian reserves. What do we mean by very low ovarian reserves? Specifically, the ovarian reserves are the ovaries. That's where the eggs are. So if you are trying to get pregnant and you are having issues getting pregnant, then it is high time you do the AMH level test. It's very important that you do an anti-Mullerian hormone levels. It can show how your ovaries are. It can show how your follicles are. If at all the report shows that your levels are very low, then your doctor may induce ovulation, may give you drugs to stimulate ovulation, for example, Clomid or Letrozole. So it is very, very important if you are a couple and you have tried to get pregnant, you've tried to get pregnant but things are not working out, it is high time you do the AMH test. Thank you, my friend. We are talking about the AMH test, and Gerard Massa, the health educator, is the name of the channel. I welcome you to our channel. If it's your first time on our channel, remember to subscribe so that you do not miss new videos we talk about every day. We talk about fertility, the ovulation calendar, and we do create awareness about fertility and reproductive health. Anti-Mullerian hormone is our topic for today, and in a nutshell, we've said that this is a fertility test which is used to measure your ovarian reserves. In simple terms, it is a test which is used to determine how your ovaries are, how your eggs are. So if at all the results come out and they are very high, then it means if you actually have a report or you have an AMH level of at least maybe 5. We said normal is between 1 up to 4. If the results come out and you have an AMH level of 5 or 6, then it means there are high chances that you could be having what we call polycystic ovarian syndrome or polycystic ovarian disease. How can you confirm that you have polycystic ovarian disease? Your doctor will do a pelvic ultrasound scan, which will specifically look at your ovaries, and whenever you have small fluid-filled swellings known as cysts, and they are at least 9 and above, maybe you have 15 or 20, then you could be having a condition which is called polycystic ovarian disease. So in this video, we've talked about anti-Mullerian hormone, and it is a very important test for all couples trying to get pregnant. It can show whether you have issues like polycystic ovarian disease or you have low ovarian reserves. Remember, we said that low AMH levels directly signify how your ovaries are. When you have normal AMH readings, then it means your fertility is okay. If you have very low AMH levels, then it means you could be having issues with your ovaries. They are very low. You may need stimulation. This can be done by your doctor. This video is for education and information purposes only. Welcome to our channel. See you in my next video. Gerard Massa, the health educator, and have yourself a fantastic and healthy day. Bye-bye. Why are you not seeing your periods after a miscarriage? You have had a miscarriage and you are not seeing your periods. Why are you not able to see your periods after a miscarriage? I welcome you, my friend, for today's lesson. One of our viewers asked a question and she said, why is she not seeing her periods after her miscarriage? It's coming to 2 months. She is not able to see her periods. We are answering this question. Watch up to the end because there are lots of tips for you to answer this question. So without further ado, we shall first of all talk about what a miscarriage is. When we are talking about a miscarriage, specifically, this is a pregnancy loss at least before the pregnancy makes 20 weeks. So if you are pregnant and before the pregnancy goes to 20 weeks, there happens to be a pregnancy loss or you lose the pregnancy, actually we call this a miscarriage. So why are you not seeing your periods even after you've had the miscarriage? Even after losing the pregnancy, why are you not able to see your periods? First of all, I welcome you on our channel. Gerard Massa, the Health Educator, is the name of the channel. On this channel, we do talk about fertility, we talk about pregnancy tips, we do give you advice on how you can get pregnant faster, on how you can become fertile and get pregnant faster. And then also, we do give all pregnancy tips, anything related to women health. I welcome you, and if it's your first time on our channel, remember to subscribe so that you do not miss new videos we release every day. So without further ado, I'll first of all talk about a miscarriage. A miscarriage is a serious condition. When it happens, the first thing is the couple needs to go through a process of healing, both emotionally, psychologically, and then also physically. So if a miscarriage has happened, it's always good to realize that there could have been a problem. There could have been a cause of this miscarriage to happen. You do not need to put the guilt on either of the partner. You should not take up the guilt, because when you become guilty and then you begin putting it on yourself, if you did not induce it yourself, then it may actually put you in depression, and it may affect you psychologically, emotionally, and all areas. So allow yourself time to heal, allow yourself to go through all the healing process. Follow the advice of the experts, and remember, you can get pregnant again. Even if you've had a miscarriage today or you've had a miscarriage at any time, you can still get pregnant. The only thing you need to do is you need to get the advice of the experts and then follow that advice, put in prayers. You can get pregnant faster. You need to put God first. So without further ado, we are going to answer the question that was asked by one of our viewers, and she said she had a miscarriage, but she has waited to see her periods. Her periods are not happening. Her periods are not seen. So we are saying that the first way we are going to answer this question is, first of all, to identify that if at all you've had a miscarriage, let's say you've had a miscarriage today, and then after 1 or 2 months or after 2 to 3 weeks, you are still spotting, you are still bleeding. This could mean that you could be having an issue with what we call RPOC. RPOC simply means you could be having retained products of conception. You could be having an issue with retained products of conception. Retained products of conception, we mean the pregnancy could have come out, but when there's still remaining pregnancy tissue in your womb. How can you tell that you have retained products of conception? Because you might have had a miscarriage 3 weeks back, but you are still bleeding. The only way to identify that you could be having retained products of conception, you are still having the blood coming out, the only way to identify is by doing what we call a pelvic ultrasound scan. A pelvic ultrasound scan, we've talked about it before. It is a test whereby images will be taken of your reproductive system. These are the ovaries, fallopian tubes, and then your womb. The pelvic ultrasound scan will show how your womb is. If there are retained products of conception, your inside, the endometrial stripe, will not actually be visible. Your doctor will not be able to see this inner lining known as the endometrial stripe. What will be seen on a pelvic ultrasound scan to confirm that you are having retained products of conception will be lots of contents. We call them echogenic contents. You'll see that on your report. If you do your ultrasound scan and the report comes out and it shows that you have lots of contents inside with a volume of maybe 10 mils, 50 mils, or 100 mils. I've worked on clients who have volumes of 200 mils, lots of echogenic contents. They think that probably the pregnancy actually came out fully, but when they are still having lots of contents, lots of pregnancy tissue and mixed with blood. So when you have had a miscarriage today and then after 2 to 3 weeks or after 1 month you've had a miscarriage and you are still bleeding, please urgently go and do a pelvic ultrasound scan. Do it from a reputable place whereby you'll get real results. And once these contents have been identified that you are having these, then your doctor will suggest possible alternative, or your doctor will suggest possible medical treatments for you. Your doctor may decide to give you drugs to help expel these contents if at all the volume is low. Or your doctor could actually opt for your doctor will actually advise for removal through a special procedure known as a D&C. D&C simply means dilatation and curettage. It's a procedure which is done in theater whereby these contents will be removed manually, and normally it's a painful procedure, but you need to prepare yourself psychologically for this. And yes, your doctor will take you through all the counseling preoperatively, that is before you go to theater. Your doctors and the nurses, the attending nurses, they will help educate you on what will be done in the theater, and then of course you are supposed to sign the consent form allowing that this procedure gets done. And after this procedure has been done by your doctors, remember this is a procedure which is advisable. You should not refuse to do the procedure, because what happens is that if you are having these contents in your womb and then they are not removed, you are most likely going to go into what we call sepsis. Sepsis is when these contents, remember, they are mixed with blood, they may actually begin rotting. And then when they do rot, what the end results are going to be, this infection is going to filter into your bloodstream because your uterus is supplied with blood vessels. So these rotting substances or these clots can easily go into your bloodstream, and then they may actually travel to your heart, and what may result may not be good. You may go into actually shock. You may go into what we call septic shock, whereby the results will not be good. So remember to have these contents removed either through tablets if at all the volume is very low. There are drugs which can be given. This video is for education purposes only. We shall not mention all those different types of drugs. But there are special drugs which can be given. They can force your womb to expel these contents manually. Normally, you will experience pain. Remember, the pain is as a result of the contractions happening, and specifically, it may actually be similar to the contractions you get when you are giving birth. But remember to be strong, have this removed, and then give yourself a waiting time of at least 3 months. After these 3 months, you can still get pregnant again. But I always advise my clients to use these 3 months as a time of healing, as a time of identifying what was the cause of the miscarriage in the first place. So we've talked about the miscarriage, we've talked about what could be the causes of bleeding after the miscarriage. We are going to answer the question that was asked by one of our viewers, and she said that she has not been able to see her periods after 2 months of having the miscarriage. She had the miscarriage and then 2 months passed, but she is not able to see her periods again. So we are answering this question. Remember, you are on Gerard Massa, the healtheducator.com, the best fertility pregnancy channel. So ask me all your questions in the comments. I really love to answer all your questions. Ask me anything about pregnancy, about fertility, about how you can get pregnant faster, and I will answer. I will give you my best advice on how you can get pregnant faster. So we are saying that when you are not able to see your periods after 2 months of having had a miscarriage, then the cause could be that there's an imbalance in your hormones. But before we answer this question, we need to identify, or we need to understand that normally when a miscarriage has happened, there's always a cause. When a miscarriage happens, there's always a cause. To see your periods, to get pregnant again after having a miscarriage today, the most important thing is identify the cause. So to wrap up the whole thing, to answer this question that was asked by our subscribers, she's not able to see her periods, the answer is identify the cause of the miscarriage in the first place. We say that miscarriages have causes. If the cause of the miscarriage was stress, remember when a woman is pregnant and she's undergoing excessive stress, she's experiencing excessive stress, there are high chances that there's going to be a hormone. It is called cortisol. It is a stress hormone. So when cortisol has been released, there are high chances that it's going to bring about a miscarriage. So if the cause of the miscarriage was stress, address the stress, manage the stress, and then your periods will simply come back, because when you are out of stress, there are high chances that your hormones are going to go back to normal, they are going to balance. If the cause of the miscarriage was infections, probably maybe you had a PID, also known as a pelvic also known as a pelvic inflammatory disease. If you had a PID, which is actually confirmed, which is confirmed by doing a pelvic ultrasound scan, free fluid will be seen in a part which is known as the pouch of Douglas. Remember, we've said that the pouch of Douglas is the part between your rectum and your uterus. So if there's free fluid collecting in that part, and you were pregnant and you had the PID, then it's very simple. Treat the PID and then your periods will come back to normal, because PID brings about an imbalance in your hormones. And remember, to see your periods normally, your periods have to be normal. Your hormones have to be normal. You have to be going through the three phases. That is the follicular phase, when the eggs are growing, the ovulatory phase, when you are ovulating, and then also the luteal phase, when you have just finished ovulation and probably you've got pregnant. Then the periods do not happen. They will not appear. If at all you do not get pregnant, then these hormones are going to drop and then you'll see your periods. Ask me all your questions and I will answer them. So to answer the question asked by our subscriber, she has not been able to see her periods. The answer is find out the cause of the miscarriage. Go to hospital, let your doctor do all the routine tests. Hello my friend, I welcome you for today's video lesson. We are talking about a paratubal or a para-ovarian cystic mass. You have done the ultrasound scan and the results are showing that you have what we call a tubal ovarian cystic mass. What is a tubal ovarian cystic mass? Your doctor has told you that you have a mass, you have a cyst between your ovaries and between your fallopian tubes. In this video, we are going to discuss all this. We shall also give you some pregnancy tips and how you can get pregnant faster. Naturally. Gerard Massa, the health educator, is the name of the channel. I welcome you, my friend, and if it's your first time, remember to subscribe so that you do not miss videos we release every day about fertility and reproductive health. On this channel, we create awareness about fertility and reproductive health. We are talking about a tubal ovarian cystic mass. What is a tubal ovarian cystic mass? When we look at the name, tubal ovarian cystic mass, tubal means your fallopian tubes, and then ovarian specifically comes from the word your ovary. So a tubal ovarian cystic mass is a mass which is between your ovaries and your tubes. But specifically, there are three major types of masses or swellings which are found in the reproductive system of women. The first is what we call a myoma, which is a mass filled with muscular tissue. Myo means muscle. And then we have also masses known as fibroids. And fibroids are specifically swellings or masses which are filled with fibrous tissue, and that's why we get the word fibroid from the word fibrous. But in this video today, we are talking about a tubal ovarian cystic mass. How does it appear? How does your doctor know that this is a tubal ovarian cystic mass? When we take a closer look at your ovaries, as you can see in this picture here, the ovary is specifically that organ which is responsible for producing the eggs or releasing your eggs on every 14th day of the month during a process known as ovulation. So what if you have your ovaries? They are normal, they are having the follicles or they are releasing the eggs. You are seeing your periods every month. But at the end of it all of a sudden, you begin feeling sharp pain in your side, either on the left side or on the right side. Then it is high time, my friend, you go to hospital and have some checkups done. The checkups we are talking about include a pelvic ultrasound scan. Mu video eno leero tuli kwogera ku ebizimba, twogera ku bizimba, tuli kwogera ku bizimba bye bayita tubal ovarian cystic mass. This video is going to be in Luganda and in English. So we tuba twogera ku bizimba ebitawanya abakyala, ojja kulaba nti ebizimba bino bya mirundi esatu. Waliwo ekizimba ekisooka kye bayita fibroid, ekizimba ekyokubiri kye kino kye bayita myoma, then ekizimba ekyokusatu kye kino kye bayita cyst. We are talking about these three types of, we are talking about the cysts, and we are saying that the tubal ovarian cystic mass specifically can be identified on ultrasound scan, and we have said that when you take a closer look at how a cyst appears, normally it has a thin wall, and then it is also filled with free fluid, or it is filled with fluid, and it is actually, when you look at it on ultrasound, when you take a closer look at the ultrasound image, it's normally very black. Tuli kwogera ku bizimba era tuligamba nti ekizimba kye bayita cyst oba tubal ovarian cystic mass, ekizimba ekyo kisangibwa between oba kisangibwa mu makati ga ejjiryo lye bayita ovary n'enseke ze bayita fallopian tubes. Era tugambye nti kino ekizimba oba ng'okyetegereza ku kafaananyi ako akabeera ku kifaananyi kya ultrasound oba ku bbaluwa ye eya scan oba ka TV, oba otunudde kafaananyi ako akabeerako, ojja kulaba nti ekizimba ekyo kiba kya black, kibeeramu kwegamba kiba kya round naye ate kibeeramu ebintu ebya black. Ebintu ebya black ebyo ge mazzi oba ge tuyita free fluid. Let me know if you have any questions down below in the comments below this video. I will answer all your questions. Gerard Massa, the health educator, is the name of the channel, and we are talking about the tubal ovarian cystic masses. How can you manage these tubal ovarian cystic masses? Ojjanjaba otya ebizimba bino katugeze oba ozuuliddwa nti olina ekizimba kye bayita cyst. The treatment of tubal ovarian cystic masses specifically begins with doing some tests, doing some investigations. Okujjanjaba okw'ebizimba kirungi nnyo n'oba nga at least doctor wo asooka n'akola ku tests okuzuula ebizimba bino byajja bitya. Most of these tubal ovarian cystic masses, or most of these cystic masses which attack the ovaries or which grow in the ovaries specifically, they tend to resolve by themselves. They can disintegrate. Those which can disintegrate or disappear on their own, even without treatment, are known as the corpus luteal cysts. Ebizimba bino byo byennyini bisobola okuba nga bibula ate n'oba tofunye bujjanjabi. Katugeze bino ebizimba bye bayita corpus luteal cysts bisobola okuba nga byo byennyini bibula. So oba nga obadde okebeddwa naye ebbaluwa yo neeraga nti olina ekizimba kye bayita the corpus luteum cyst oba corpus luteal cyst, then oba tolina kweraliikirira ebiba bigenda kuba bibula. Naye oba olina olubuto era olubuto lusobola okukula obulungi naye ng'ate akazimba ako ne kaba nga kasaanuuka ne kaba nga kasaanaawo kwokka. What if you have the tubal ovarian cystic mass and it does not disappear on its own, it does not disintegrate? Then you need to do some more tests you need to do a laboratory test for your hormones. You need to look at how your follicle stimulating hormone is, how your estrogen levels are, and then also you need to do what we call the AMH test or the anti-Mullerian hormone levels. We've talked about the anti-Mullerian hormone levels. If you missed that video, after this video, please kindly check in our video library. There's a video on the anti-Mullerian hormone. Tugambye nti obanga ozuuliddwa nti obadde olina kino ekizimba naye ate ne kiba nga tekisobodde kubanga kibula kyokka, then olina okumakinga sure nti okola test eya hormones oba gye bayita the anti-Mullerian hormone level test and the follicle stimulating hormone test oba FSH test. Test zino eza hormone ziba zituyambako okulaba kyandibanga ebizimba bino biri kujja olw'okubanga hormones zo zibadde tezibalansinga. Remember, for these cysts to grow, you actually have to realize the fact that these cysts actually can grow from some specific areas, for example, where the Mullerian ducts are, oba ebitundu ebivaamu oluseke lwe bayita the Mullerian ducts. So, when you do the AMH level test, or when you check your anti-Mullerian hormonal levels, and you discover that it is actually higher than 4, because the normal is supposed to be 1 up to 4. If your results of the anti-Mullerian hormone levels come out and they are higher than 4, then it means you are at high risk of developing a condition known as polycystic ovarian disease. It could be that you are having a single tubal ovarian cystic mass, but when your AMH levels are high, then there are high chances that you could develop that. And specifically, there are medications which will be prescribed to you by your doctor to stabilize your hormones. Obanga obadde ozuuliddwa nti obadde olina results zino ate nga ziraze nti hormones zo tezibalansinga, oba okoze test ya AMH ne results nezifuluma ne doctor onakugamba nti results eza AMH ziri waggulu nnyo, then eddagala weeri erisobola okubanga likuweebwa ate n'obanga hormones zo zistabilizinga, bino ebizimba ne bibanga bisaanuuka obanga bisaanawo byokka. Tubal ovarian masses or tubal ovarian cystic masses normally can resolve with medication, but if at all they do not resolve and they are higher, they are actually around 100 millimeters and above, or they are so big in size, then your doctor or your specialist can opt for surgery, where they will be removed in theater. Ebizimba bino bibanga bibadde byeyongedde okubanga binene nnyo ate biri kuleetera obulumi nga bungi nnyo, then doctor wo asobola okusalawo n'abanga akutwala mu theater ne babanga bakuoperatinga ne babijjamu ebizimba ebyo. Kitwale nti g'amazima gennyini osobola okubanga otereera, naye the most important thing olina okumakinga sure nti okola test oba olina okubanga okola scan. I thank you, my friend, for attending today's video lesson. I hope you've picked something about tubal ovarian cystic masses. We have said that these tubal ovarian cystic masses normally are those masses which are filled with fluid, but still they grow between your ovaries and your tubes. They could actually even be localized next to your ovary. The most important way to note these ovaries, to note these cysts, is by doing a pelvic ultrasound scan, which will confirm presence of these masses, and then also measurement will be taken. Tests on your hormones, for example, the test for FSH and AMH can be taken. If the levels show that you are having high FSH levels, then there are specific drugs which may be given. Your doctor or your specialist will be the one to decide. Do not self-medicate. This video is basically for information purposes to make you aware of how your system is. We create awareness about fertility and reproductive health. But my friend, one thing you have to note is that you can get treatment and you can get better even if you have been told that you have the tubal ovarian cystic masses. You can be treated. There are specific drugs, for example, the gonadotropins, which will be prescribed to you by your doctor. And yes, when you take these according to your doctor's instruction, you can actually get rid of these cysts, and then also you can get pregnant. Remember, these cysts do not prevent you from getting pregnant. The only issue is that please have yourself checked before you go ahead and get pregnant. Just have a routine pelvic ultrasound scan. You'll be able to see how your system is before you conceive. I welcome you to our channel. Remember to subscribe for new videos we release every day. Nkusanyuse nnyo mukwano gwange okuwuliza ku channel yaffe, era ndowooza olina ky'oyizeemu mu video yaffe ya leero. Tubadde twogera ku bizimba bye bayita para-ovarian cystic masses oba tubal ovarian cystic masses. Tugambye nti ebizimba bino bitera nnyo okujja byokka nga obadde olina issues oba hormones tezibalansinga, era ne tugamba nti obanga ozuuliddwa nti obadde olina obuzibu buno osobola okufuna treatment n'oba bulungi nnyo. Bwe biba nga binene nnyo basobola okutwala mu theater ne bakooperatinga n'oba ng'osobola okufuna olubuto. Subscribinga obeere ng'olaba video zaffe buli kanaku. Omukama tukuume. Bye bye. May God bless us all. Have yourself a fantastic and healthy day. Bye bye. Hello my friend, we are talking about a missed period with a negative pregnancy test. Have you missed your periods? Have you done the pregnancy test and the pregnancy test is showing you that it is still negative? You are asking yourself what could be happening to you. A missed period with a negative pregnancy test. I welcome you to our channel, Gerard Massa, the health educator, and on this channel we do create fertility and reproductive health awareness. Welcome to our channel, and if it's your first time on our channel, remember to subscribe so that you do not miss new videos we release every day. Today we are talking about a missed period with a negative pregnancy test. We are looking at what could be causing you to see a negative pregnancy test and yet you have missed your periods. The first thing we need to take into consideration is that for you to see your periods normally and regularly, you should be having a healthy reproductive system, and then also you should be ovulating. You should be ovulating very well. By ovulation, I mean you should be able to release a mature egg on the 14th day. But what if you have undergone ovulation, you are actually seeing all the signs of ovulation, and then you are expecting to see your periods in the next 2 weeks, but you do not see your periods. Probably you go ahead and miss your periods for even 2 to 3 months. What could be happening? So when you are seeing a missed period with a negative pregnancy test, the commonest thing we need to take into consideration is, are you taking any family planning medications, or are you taking any medications? The causes of a missed period with a negative pregnancy test could be that you could be taking some medications. For example, if you are taking family planning drugs, if you are taking family planning medications, this could be pills, there could be the IUD which is inserted into your womb, and then it could actually even be a family planning method, like maybe a no plant or an implant attached or inserted into the posterior part of your arm. So these family planning methods bring about a missed period. If you are not seeing your periods and you are on family planning, then it could be a direct effect of the medication you are taking. A missed period could be a direct effect of the family planning medication you are on. Also, if you are missing your periods and you are not actually pregnant, you do the pregnancy test and the test is negative, this could be due to stress. A woman who is stressed mostly will end up having missed periods. They may actually not be able to see their periods. So I welcome you to our channel, Gerard Massa, the health educator, and on this channel we do talk about women's health, we talk about fertility, we create awareness about fertility and reproductive health. So when you are not seeing your periods and you do the pregnancy test and it is negative, it could be due to stress, as we've just said. It could be that you are taking some family planning medications, or you could be taking other drugs which could be interfering with your hormones. The other main reason of you not seeing your periods is that probably you could be pregnant, but maybe you have tested very early. Very early testing, for example, you miss your periods after 1 week, you go and do the test. You could actually do the test with the urine pregnancy tests, which were actually maybe expired or they were stored badly. And then when you do the test and it shows you negative and you missed your periods, it could be that maybe you tested very early. The other point, the other reason for a missed period is that you could actually be having an issue or a case of irregular periods. You could miss your periods and yet already you are experiencing irregular periods, which could be brought about by some conditions. These conditions include polycystic ovarian disease, where your ovaries have lots of small growths or small cysts. Let me answer all your questions and I will be able to answer all the questions you ask me. Please ask your questions down below the comments of this video and I will answer all your questions. Gerard Massa, the Health Educator, is the name of the channel, and today we have talked about missed periods. Why are you not seeing your periods and yet you are not pregnant? And we have said that there are many causes of you missing your periods. The first cause is it could be that you are stressed. You could be on family planning medications, you could be having irregular periods, or you could be having disease of the womb. For example, if you have polycystic ovarian disease, then there are high chances that you may miss your periods for many cycles, or you could have an issue of irregular periods. I'm really so happy that you have watched our video, and remember, we are proceeding with our lesson.
How to calculate your ovulation cycle, how to calculate your ovulation calendar, how to calculate your ovulation calendar, how to track your safe days and your danger days using the calendar method. Assuming you are seeing your periods on the first day, which is around this period on Monday, assuming your first day of your period is on first, which is Monday, and then you see your periods again on second, you see your periods again on third, that is Wednesday, and then also you see your periods on fourth. We want to use this method to identify the days you are going to ovulate. Remember, we've said that when you see your periods on day 1, that is on Monday, day 2, that is Tuesday, day 3, that is Wednesday, and day 4, that is Thursday. Just we are using this as an example, but it could be actually any other day of the week, but we are using this as an example. So in this particular case, you see your periods for 4 days, that is 1, 2, 3, 4. You started on first, which was Monday, and then you finished on Thursday, which is actually the 4th of Thursday. You want to know your ovulation days, the days you are most likely to get pregnant. We are supposed to do the counting. First of all, we shall understand what an ovulation cycle is. An ovulation cycle, or the ovulation day, the days of ovulation, are those days when a mature Graafian follicle or a mature egg is released, and the chances of getting pregnant are very high. So you saw your periods from first, second, third, and fourth. What we are supposed to do is to count the days from the first day of seeing the periods to the first day of the next period. Assuming your next period is going to be around maybe 26th, 27th, 28th, okay, and maybe 24th when you are getting off your periods. Assuming your next period is from 26th, 27th, 28th, and 29th. If you want to identify the days of ovulation, the days you are most likely to get pregnant, you are supposed to count from the first day when you saw your periods, count 14 days. And on the 14th day, add 3 days in front and add 3 days backwards. We are saying that to calculate your ovulation days, you count the first day when you saw your periods and you count 14 days. On the 14th day, add 3 days, add, subtract 3 days, and specifically those are the days you are most likely to get pregnant. We shall go and do it practically. Assuming you saw your periods here, this is the first day you saw your periods, that is Monday 1st. So we are going to count and say 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, and 14. So according to this cycle, the 14th day is specifically here, and that is on Sunday. But according to our method, we said that when the egg has been released, or when ovulation is taking place at this 14th day is the peak period when you are most likely to get pregnant. We add 3 days in front. We say 1, 2, 3. Come back on the 14th day, and we also add 3 days backwards and say 1, 2, 3. So the days you are most likely to get pregnant, or the days of ovulation, are from 11th, 12th, 13th, 14th, 15th, 16th, and 17th. Specifically 3 plus 3 you get 6, plus the 14th day, which is 1, you get 7. So it's always that week. It's always 1 week. To get this, we shall go backwards. We shall repeat this again for our friends who have not picked it. We said that to understand the days you are most likely to get pregnant, we start from the first day when you saw your periods. Assuming you saw your periods around here, the first day of seeing your periods, count from the first day when you saw your periods, count 14 days and say 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14. And we've said that the 14th day is the day you are ovulating, but this process goes on for the next 3 days, and it also starts the first 3 days before you saw your 14th day. So you add 3 days in front, add 3 days backwards, and specifically from this period up to this period, those are your unsafe days, or your days of ovulation. If you do not get pregnant in around here, then the egg goes into what we call a corpus. It becomes what we call a corpus luteum, or a corpus luteal phase. The next 2 weeks are basically the egg which was supposed to become fertilized. The egg which was supposed to be fertilized, if it is not fertilized, the remaining follicle becomes what we call a corpus luteum. We shall talk about that in our next video, but in today's lecture, as I'm summarizing, we have been talking about how to calculate your ovulation cycle, how to calculate your ovulation days, how to track your safe days and your danger days using the calendar method. And we've said that simply to understand your menstrual cycle, you have to count from the first day when you saw your periods to the next day when you will see the next period. Thanks a lot for staying with me. Gerard Massa, the Health Educator, is the name of the channel. Have yourself a fantastic and healthy day. Remember to subscribe for new videos every day about women health. Bye bye. Hello, welcome.
Why you have been told that you are not getting pregnant? Have you ever asked yourself why you are not getting pregnant? You have taken all the drugs, you have followed all the diet plans, but still you are not getting pregnant? This is Gerard Massa from gerardmassa.thehealtheducator.com, and on this channel we do create awareness about fertility and reproductive health. We are going to answer a question that has been asked by one of our viewers, and this question is this: I had a miscarriage, will I get pregnant again? One of our viewers had a miscarriage and she's asking, will she be able to get pregnant again? Watch this video up to the end and we are going to answer this question together. This is Gerard Massa, the Health Educator, and I welcome you on our channel. Remember to subscribe for new videos about fertility, about reproductive health. We release every day at 17 hours. So, she's saying that she had a miscarriage. Will she be able to get pregnant again? One thing we should take from this question is that there's this word called a miscarriage. A miscarriage is early pregnancy loss. when a woman is pregnant and before the pregnancy makes 20 weeks, the pregnancy comes out, we call that a miscarriage. There are many types of miscarriages or abortions, and specifically we shall not go into all the details, but in brief we have one which is inevitable. An inevitable miscarriage happens whether you've done anything, whether you've taken any drugs or you've not taken any drugs, or it just happens. And then there's that whereby it is incomplete, and then there's another type which is actually complete, and then of course there are other types which are actually known as molar miscarriages. So we are talking about a miscarriage. We are answering this question by one of our subscribers who said that she had a miscarriage and she would like to know, will she be able to get pregnant again? When you look at this question, you realize that at first she was pregnant and then she had a miscarriage. Just by the mere fact that she got pregnant, this means that she can still get pregnant again. The most important thing we need to do here is that she needs to do what we call a pelvic ultrasound scan. She needs to do some tests and then identify what caused the miscarriage. And then after identifying what could have caused the miscarriage, she can still go ahead and get pregnant again. So we are answering a question by one of our subscribers, and she said she had a miscarriage. The question is, will she be able to get pregnant again? The answer is address or handle what caused the miscarriage, and then you will be able to get pregnant again. There are many causes of miscarriages. The commonest causes are infections, for example, a PID, when a woman gets an infection and then she does not treat it very well, specifically a urine tract infection, and then she treats it poorly or she does not get treatment. There are high chances that this infection can ascend upwards up to your cervix, and then it may cause what we call cervical incompetence, or your cervix may actually open up and you can end up into a pregnancy loss. So to answer a question asked by one of our subscribers, it is very, very possible that you can get pregnant again, but use that time after they've done the cleaning of your womb. Use that time to find out more about what could have caused the miscarriage. So we are proceeding with our answer for this question, and we have said that the commonest causes of miscarriages include infections. They do also include stress, and then of course also overactivity. If you are pregnant and you are working a lot, you are sitting for, actually you are doing lots of activities, you are carrying heavy things, you are moving from place to place, and you are pregnant, you are still actually in the early stages of pregnancy, you are in the first trimester, but you are moving a lot, overactivity can bring about pregnancy loss. So if you are pregnant and you are in your first months, it is very advisable that you do the routine checkups so that actually if at all an infection is identified in your urine, it will be treated by your doctor. And then also if you are undergoing lots of stress, it is very important to deal with the stress, because one thing that is true is that you cannot run away from your stressors, but you can look for ways of either avoiding the stressor, adjusting to the stressor, or even altering the stressor. Because when you are pregnant and you are exposed to constant stress, there's a hormone known as cortisol, which will...
How to calculate your ovulation cycle, how to calculate your ovulation calendar, how to calculate your ovulation calendar, how to track your safe days and your danger days using the calendar method. Assuming you are seeing your periods on the first day, which is around this period on Monday, assuming your first day of your period is on first, which is Monday, and then you see your periods again on second, you see your periods again on third. that is Wednesday. And then also you see your periods on 4th. We want to use this method to identify the days you are going to ovulate. Remember, we've said that when you see your periods on day 1, that is on Monday, day 2, that is Tuesday, day 3, that is Wednesday, and day 4, that is Thursday. Just we are using this as an example, but it could be actually any other day of the week, but we are using this as an example. So in this particular case, you see your periods for 4 days, that is 1, 2, 3, 4. You started on 1st, which was Monday, and then you finished on Thursday, which is actually the 4th of Thursday. You want to know your ovulation days, the days you are most likely to get pregnant. We are supposed to do the counting. First of all, we shall understand what an ovulation cycle is. An ovulation cycle, or the ovulation day, the days of ovulation, are those days when a mature Graafian follicle or a mature egg is released, and the chances of getting pregnant are very, very high. So you saw your periods from 1st, 2nd, 3rd, and 4th. What we are supposed to do is to count the days from the first day of seeing the periods to the first day of the next period, assuming your next period is going to be around maybe 26th, 27th, 28th, okay, and maybe 24th when you are getting off your periods. Assuming your next period is from 26th, 27th, 28th, and 29th. If you want to identify the days of ovulation, the days you are most likely to get pregnant, you are supposed to count from the first day when you saw your periods, count 14 days. And on the 14th day, add 3 days in front and add 3 days backwards. We are saying that to calculate your ovulation days, you count the first day when you saw your periods and you count 14 days. On the 14th day, add 3 days, subtract 3 days, and specifically those are the days you are most likely to get pregnant. We shall go and do it practically. Assuming you saw your periods here, this is the first day you saw your periods, that is Monday 1st. So we are going to count and say 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, and 14. So according to this cycle, the 14th day is specifically here, and that is on Sunday. But according to our method, we said that when the egg has been released, or when ovulation is taking place at this 14th day is the peak period when you are most likely to get pregnant. We add 3 days in front. We say 1, 2, 3. Come back on the 14th day and we also add 3 days backwards and say 1, 2, 3. So the days you are most likely to get pregnant, or the days of ovulation, are from 11th, 12th, 13th, 14th, 15th, 16th, and 17th. Specifically 3 plus 3 you get 6, plus the 14th day, which is 1, you get 7. So it's always that week. It's always 1 week. To get this, we shall go backwards. We shall repeat this again for our friends who have not picked it. We said that to understand the days you are most likely to get pregnant, we start from the first day when you saw your periods. Assuming you saw your periods around here, the first day of seeing your periods, count from the first day when you saw your periods, count 14 days and say 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14. And we've said that the 14th day is the day you are ovulating, but this process goes on for the next 3 days, and it also starts the first 3 days before you saw your 14th day. So you add 3 days in front, add 3 days backwards, and specifically from this period up to this period, those are your and safe days, or your days of ovulation. If you do not get pregnant in around here, then the egg goes into what we call a corpus. It becomes what we call a corpus luteum or a corpus luteal phase. The next 2 weeks are basically the egg which was supposed to become fertilized. The egg which was supposed to be fertilized, if it is not fertilized, the remaining follicle becomes what we call a corpus luteum. We shall talk about that in our next video, but in today's lecture, as I'm summarizing, we have been talking about how to calculate your ovulation cycle, how to calculate your ovulation days, how to track your safe days and your danger days using the calendar method. And we've said that simply to understand your menstrual cycle, you have to count from the first day when you saw your periods to the next day when you will see the next period. Thanks a lot for staying with me. Gerard Massa, the Health Educator, is the name of the channel. Have yourself a fantastic and healthy day. Remember to subscribe for new videos every day about women health. Bye bye. Hello, welcome to our channel. I'm Gerard Massa, the Health Educator. On this channel, we talk about pregnancy related questions. We answer all your on your uterine wall, on your uterine lining. We call this implantation, and then growth takes place, becoming a baby. So to answer the question, can you get pregnant on the first day of your period, we shall first of all take this as an example. If you see your periods on any particular date, for example, if you see your periods on 9 being your first day, we know that you have to count 14 days, and on the 14th day, that is when you are most likely to get pregnant. So to answer the question, can you get pregnant on the first day of your period? It's not really possible for you to get pregnant on the first day of your period. The main reason is that on the 14th day, that is when you are ovulating. That is when the chances of getting pregnant are very high. So on the first day, your periods are coming out, but it is really not possible to get pregnant on the first day, because the first week, the first day followed by the second day, the third day and the fourth day, if you spend 4 days in your periods, normally there's shedding of blood, there's basically menstruation happening. So it's not possible for you to be pregnant, because that is not the period, that is not the time when you are ovulating. The only time you can get pregnant is when you are ovulating, and normally that is on the 14th day. And specifically, during the process of ovulation, there is a release of several hormones, but we shall talk about 2 main hormones here. The first hormone is what we call estrogen, and then the next hormone is progesterone. And also there's another hormone which is very important, and it is known as the luteinizing hormone. So the only way to confirm whether you are able to get pregnant is by using what we call the ovulation predictor kits. These can easily be got in any nearby pharmacy near you, and these can easily be used. They look like pregnancy test strips, but they can tell whether you are in your ovulation or whether you are about to get pregnant. So to maximize the chances of getting pregnant, if we take an example of 24th, if this is the date you are ovulating, we always advise that you be with your partner at least at least 1 day before your date of ovulation. The main reason is that the hormone known as the luteinizing hormone is actually very high when you are about to go into ovulation date. If you are about to enter your date of ovulation, then normally we advise that you be with your partner. So the only time you can get pregnant is during ovulation, 3 days before, 3 days after. That period you can easily get pregnant. If at all you are on your first day of your periods, it is not possible for you to get pregnant. And remember, this is Gerard. Can you have fertile cervical mucus but not ovulate? can you have fertile cervical mucus but not ovulate? In this video today, we are going to answer the question, can you have fertile cervical mucus but at the same time not ovulate? Gerard Massa, the health educator, is the name of the channel. I'm really so happy to talk to you, my friend. Thank you for subscribing. You'll be able to get new videos I put out every day about women's health, about fertility, infertility, pregnancy related topics. On this channel, Gerard Massa will talk about women's health. So in today's lesson, can you have fertile cervical mucus but not ovulate? We are going to begin by defining what we mean by the term ovulation. Specifically, ovulation is the release of an egg which is mature, and this happens on the 14th day. If we take an example of this calendar, assuming we are using basically an example, if you saw your periods on day 3 and then on day 4 and then on day 5, what happens is that to calculate your ovulation date, the day you are ovulating, you specifically begin counting from day 3, and you begin counting, we take the first day you saw your periods to be our day 1, and then we shall say 1, 2, 3, and then we shall proceed and count up to 14. So this is 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14. So if you saw your periods on day on 3rd, that being our day 1, your ovulation date is 16. So ovulation means chances of getting pregnant are really increased. The chances of getting pregnant, or the day you are most likely to get pregnant, is what we call the ovulation day, and it's basically the 14th day from the first day you saw your period. We are using this as our background study to answer our question, can you have fertile cervical mucus but not ovulate? Having understood ovulation, that this is the release of an egg which normally happens on the 14th day, an egg begins an egg is released when it actually is really small on the 14th day, and then it goes on, actually an egg begins growing during the follicular phase, and then it begins growing, and then it goes on until it becomes a mature egg. So on the 14th day, it is actually called the Graafian follicle. So when this egg has been released, it normally lasts for only 12 to 24 hours. When an egg is released during ovulation, it lasts for only 12 to 24 hours. So to answer the question, can you have fertile cervical mucus but not ovulate? It is very possible for you to have fertile cervical mucus but at the same time not ovulate. What we need to ask ourselves is this: what could be causing this fertile cervical mucus to be released but at the same time not ovulate? There are many causes for this, but we shall explain the most important causes of you seeing your fertile cervical mucus, which is actually the color of watery raw egg white. So when you begin seeing a discharge which is watery and then it is having raw egg white, normally that is a sign that you are actually ovulating or you are about to ovulate. But there are some women who will see the same discharge, have fertile cervical mucus, but at the same time not ovulate. Remember, we said that the whole process of ovulation is controlled by two hormones. These are the follicle stimulating hormone and then the luteinizing hormone. So if at all these hormones are not being produced in sufficient quantities, there's going to be, your body will begin making the changes, your body will begin making the changes of ovulation, but the whole process of ovulation will not happen. It will not happen. So you actually will be able to get a rise in the temperature. You will actually also have that cervical fluid which will increase, but ovulation may not take place. This is also known as anovulation, failure of ovulation to happen. normally it is due to the body having issues. For example, if a woman has a disease of the ovaries known as polycystic ovarian syndrome, abbreviated as PCOS, it actually can make you to feel as if you are ovulating. You will get the signs of ovulation. The discharge, the watery discharge will come out, but ovulation may not happen. As a result, getting pregnant becomes difficult. So if you have tried to get pregnant, you calculate your days very well, you ovulate, but at the same time you do not get pregnant, it is high time you may actually need to go and talk to your doctor or your reproductive endocrinologist or fertility expert, who will request some tests to be done on you. And the commonest tests that are done include the pregnancy or the pelvic ultrasound scan, and then also the fertility hormonal screen test, whereby hormones are checked to really assess their levels in your body. The hormones that are normally tested are progesterone. Progesterone normally increases after ovulation. Progesterone increases immediately after our ovulation, and then this hormone is supposed to increase because it is a pregnancy-friendly hormone. Progesterone rises because it is preparing the body, it is preparing your womb for the fertilization or the fertilized egg that happened, the fertilized egg that is coming in from the fallopian tubes. So if you see your fertile cervical mucus, we know that you are ovulating. But if we go ahead and then test for progesterone, and then the levels of progesterone are very low, and yet we know that progesterone is supposed to be high, indicating that ovulation has happened, the next step is pregnancy. So if we test for your ovulation, we test for your progesterone levels, and immediately after you've ovulated and the levels are low, then it means you could be having a problem, whereby treatment can be given. The other hormone that is tested is the follicle-stimulating hormone. Sorry about that. The other hormone that is tested is the luteinizing hormone and the estrogen hormone. These are also very important in determining ovulation because they tend to rise when you are about to go into ovulation. Luteinizing hormone and estrogen rise when you are about to go into ovulation, and then after ovulating or on the ovulation date, they peak, they rise so high, but immediately after they also tend to go down. So can you have fertile cervical mucus but not ovulate? The answer is yes. You can have fertile cervical mucus but not ovulate. It is also known as anovulation. The best advice is your doctor will order or will request a pelvic ultrasound scan, and then also your doctor will request fertility hormonal screen tests or a test of your hormones to determine the cause. The good news is that if at all you go and get these tests done, if you do the pelvic ultrasound I'm talking about here include the HCG or the human chorionic gonadotropin hormone, and then the estrogen hormone, and then also progesterone, and lastly prolactin. These four hormones, when they are actually increasing in size due to a woman getting pregnant, when these hormones increase in their levels, I'm sorry about that, they increase in their levels, normally they tend to bring about the changes which basically include the tender or painful breasts, and then also swollen breasts. So our first early warning sign of pregnancy is tender or swollen breasts. Let me know if you have any questions down below in the comments. Ask your questions and I will answer them right away. I'm called Gerard Massa, the health educator. That's the name of the channel, and we shall move on to our next sign of pregnancy. Our next sign of pregnancy is itchy nipples in early pregnancy. When a woman gets pregnant, the increasing size of the breasts brings about increase in the elasticity of the tissue, or the skin that is around the nipples tends to enlarge, and it tends actually to increase in size. So increase in this skin normally brings about itching, that kind of like increase in the size of the nipples specifically is the main reason why the nipples begin itching. So when the nipples begin itching, just know that due to their increasing size, the increase in the elasticity of the skin is the main thing that brings about the itchy nipples. So pregnancy sign number 2 is itchy nipples. Our first point was tender or swollen breasts. We shall move on to our next early pregnancy sign. Spotting or implantation bleeding. Spotting or implantation bleeding specifically occurs when a woman gets pregnant. The fertilized egg travels through the whole journey of the fallopian tube. Remember, fertilization takes place specifically, most commonly in a part called the ampulla, that is kind of a junction of that fallopian tube. So when this fertilized egg travels the whole journey up to the uterine lining, also known as the endometrial lining, and it attaches itself on that wall, what happens is that there's what we call burrowing or digging. Imagine like you're digging into the soil. So when this fertilized egg is digging onto the uterine lining, there's rupture of blood vessels, also known as lacuna. So the rupture normally, or the burrowing of this fertilized egg, the attachment of this fertilized egg onto the uterine lining brings about release of some small drops of blood, also known as spotting. So this can also mean these signs we are talking about could also mean something else, but specifically today we are covering pregnancy. So whenever you see little drops of blood on your knicker, on that period when you are supposed to see your periods, maybe you go in your periods for 2 to 3 days, but you do not see your normal periods, but you get some little spots on your knicker, then that is a confirmation, or it could be one of the early signs to mean that you are, or you could be pregnant. We shall move to our next early warning sign. High basal body temperature. High basal body temperature specifically means your body temperature will increase when you are pregnant. Remember, the basal body temperature or your normal body temperature tends to rise. It tends to increase around day 14 of your cycle, meaning that is when you are most likely to get pregnant. On day 14, you count 3 days in front, 3 days back from your last normal menstruation date, that is specifically your ovulation period. So on day 14, the body temperature increases, but when you do not get pregnant on day 14 and you are nearing your periods, the temperature will go back to normal. But in a woman who has got pregnant or in a confirmed pregnancy, what happens is that the temperature does not come down. The temperature does not fall. It keeps rising. So when you get that temperature rising at the end of the month, you should not worry about maybe it could be a sickness. No, the first thing is wait. If at all you miss to see your periods, then you can always test. You can do the urine pregnancy test at home to remove all the worries. We shall move on to our next early pregnancy sign. Tiredness or feeling weak, feeling tired all the time. So our next early pregnancy sign is the feeling of tiredness. You feel weak all the time. Remember, this could also be a sign of your premenstrual periods, or it could be a premenstrual symptom like we talked about in our previous video. If you missed this, if you missed the lectures, then the lesson on premenstrual symptoms, you can go to our video library, and the videos are all there. We've uploaded all the videos there. You can go and watch all our videos to learn more about premenstrual symptoms, the difference between premenstrual symptoms and of course like pregnancy. So the point we are talking about here is that when a woman has just got pregnant, there's increasing fatigue, there's increasing tiredness, and normally this is due to the increasing surge of hormones, the increasing levels which are so the increasing levels of hormones that are circulating in a woman's body. So increasing tiredness or fatigue is one of the early pregnancy symptoms. Headaches, and actually a woman who has just got pregnant tends to experience lots of headache, and the main reason why the headaches tend to increase in a woman who has got pregnant is because the hormones estrogen and progesterone specifically tend to stimulate the neurotransmitters in the brain. Neurotransmitters are special parts of the brain that specifically tend to transmit messages in your brain. So the high levels of estrogen, the high levels of these pregnancy hormones simply are the estrogen and progesterone. We shall simply call them pregnancy hormones. So when a woman has just got pregnant and the pregnancy hormones are circulating in the body, they tend to stimulate the neurotransmitters, or they tend to stimulate those centers in the brain called neurotransmitters, bringing about headache. Early pregnancy symptom, we are also talking about nausea. Nausea is one of the biggest early pregnancy symptom. The main reason why nausea is being talked about here is because when a woman gets pregnant, the hormones specifically known as the HCG hormone, the estrogen, progesterone, and luteinizing hormone tend to undergo lots of changes. The most important hormone we are looking at here is progesterone. It tends to be produced in high quantities. When a woman has got pregnant, the hormone progesterone is produced by the placenta. When she has just got pregnant and the placenta has not yet formed, the hormone progesterone is always produced by the corpus luteum. So when we have all these hormones surging, increasing, they bring about nausea. Nausea can be managed very easily by trying to actually go for bland dietary foods, or go for foods that are not so oily. You could also eat more of crackers. Some ice cream will do. Some ice crystals, plain water ice crystals can help. And then also you could get some little ginger, put in hot water and take some. It can also help with the nausea. So pregnancy symptom we've talked about here is nausea in pregnancy. Frequent urination. When a woman gets pregnant, what happens is that there's lots of blood flow to the pelvic area. There's lots of blood flowing because there's something new happening in the uterus. So increased blood flow to the pelvic area puts more strain onto the whole urinary system, bringing about an increase in the urination or frequency of urination. But remember, this could also be a sign of infection. Always, if you are getting frequent, you are urinating frequently, contact your doctor so that some tests can be done. For example, the urine analysis test to confirm whether it is an infection or it could even be diabetes. So, but here we are talking about pregnancy. We shall stick to pregnancy. When a woman experiences lots of frequent urination, then this could be a pregnancy symptom. The other reason of a woman experiencing frequent urination is that when the uterus is gravid, or when the baby is beginning to form in the uterus and growing, you will discover that the increase in the size of the womb puts pressure, or it actually presses onto the urinary bladder, and you discover that some little water taken, or when you consume some little water, when you drink some little water, what happens is that the urinary bladder, since it is being compressed on by the increasing size of your womb, there will be lots of urination. Backache. A woman who has just got pregnant normally experiences backache. The main reason is that the hormones we talked about in the beginning, that is estrogen and progesterone, tend to cause the ligaments to actually kind of like be very painful, and it's more of like a change in your body that normally cannot be this is a normal thing that happens. So backache can also be due to specifically the increasing size of the womb putting strain on your spinal cord or putting strain on your backbones. So you do not need to worry if you are experiencing backache. Just know that this could be pregnancy. You can always go have the pregnancy test done, but you could also talk to your doctor if the pregnancy test is negative and you are still experiencing the backache. It could be due to overworking, overstanding, or even carrying heavy things. We shall move to our next early pregnancy. Food cravings. When a woman begins craving for particular types of foods, for example, ice cream, and also maybe pickles or any particular type of food cravings, this could actually mean that you are pregnant. Always it's recommended that when you begin craving for certain rare types of foods, then it's very important that you confirm by having the urine pregnancy test being done. Thank you, and we shall move to our next. Food aversions. When a woman begins getting food aversions, a heightened sense of smell, an increased sense of smell to particular types of foods, then we can actually begin thinking of pregnancy. The most important thing we can do is the urine pregnancy test to remove any worries. Mood swings. Mood swings specifically are due to the hormones estrogen, progesterone, luteinizing hormone. When these hormones are increasing in their levels after pregnancy has taken place or after fertilization and implantation has taken place, these hormones normally change to bring about this mood. They tend to bring about these mood swings, but remember, as the pregnancy progresses, these mood swings can also reduce. So when you begin getting mood swings, previously you were a happy woman, but now you get turned off very easily, you get annoyed very easily, then consider having a urine pregnancy test or have a pregnancy test done to confirm this could be a pregnancy sign. Cramps. Cramps are really so common, but one thing that happens is that with cramps, normally when a woman has just got pregnant, when she has been confirmed that she is pregnant, the increasing size of the uterus, the uterine muscles or the muscles of your womb in preparation of receiving this fertilized egg, or the fertilized egg growing after attaching itself on the uterine womb or on your womb, normally the changes that are happening tend to bring about the crampy, or they tend to bring about the cramp pain. So it's very important when you are getting those cramps to go have the urine pregnancy test. Remember, it could be a pregnancy, or the cramps could be a sign of something else, like maybe premenstrual. It could be a premenstrual symptom, or a sign that you could be going into your periods, and maybe you may not be pregnant, but cramps are among the first early pregnancy signs. Acne or skin breakouts. Increase in a woman's hormones, pregnancy hormones after getting pregnant, tends to bring about acne and skin breakouts. Specifically, this is purely hormonal and you do not need to worry about it. If the skin breakouts are happening around your areola or around your face, consider using some safe moisturizers depending on where you live. You can always talk to your pharmacist or you can talk to your doctor, who will recommend moisturizers that are not dangerous or that will not bleach you. So talk to your doctor or your fertility expert to advise you on which moisturizers are the best to prevent the skin breakouts. But acne or skin breakouts are among the early signs of pregnancy. A missed period. Now, this is among the best and among the most recommended early pregnancy sign. When you are supposed to see your periods, like maybe today, but you miss seeing your periods and you go on you take 1 week, you take 2 weeks, this is the best time to do the urine pregnancy test. Please do not rush to do the urine pregnancy test simply after you've missed your period. You may get a test that may confuse you. So a missed period is the most significant sign of early pregnancy, and remember to have the pregnancy test done 2 weeks after you've missed your periods. The main reason is that the hormone, the pregnancy hormone known as the HCG hormone, is always highest 1 week or 2 weeks after getting pregnant. Thanks a lot for passing by, for watching and learning from today's lesson. We were talking about early pregnancy signs, and this is a summary of the signs of early pregnancy. The first is tender or swollen breasts. Next, itchy nipples in early pregnancy, spotting or implantation bleeding, high basal body temperature, a feeling of tiredness or fatigue, headaches, you may get frequent headaches, nausea, feel like vomiting all the time, frequent urination, backache, the back pains a lot, food cravings, you crave for particular types of foods, food aversions, specifically this is like a heightened sense of smell to particular foods, mood swings. Mood swings specifically we are talking about you may feel low, you may feel high, you are happy today, tomorrow you're not happy. So that could be a sign of, it could be an early sign of pregnancy, and it's due to hormones. Cramps or pains, abdominal pains. Remember we talked about cramps, we said it is due to the increasing size of your womb. Acne or skin breakouts is also purely hormonal, and we've recommended that you could talk to your gynecologist or your doctor, who will recommend some lotions. And lastly, we've talked about a missed period. A missed period meaning that fertilization and pregnancy has taken place, so ideally there will be no shedding of the endometrial lining, because we know that shedding of the endometrial lining is basically periods, or it is menses. So when you miss your periods, it is the biggest sign to confirm that you could be pregnant. And to go ahead and confirm, you need to do the 3 recommended tests. The first test is the urine pregnancy test, which has to be done early in the morning when the levels of the HCG hormone are high. You could also do the blood pregnancy test, which looks for the HCG or the pregnancy hormone in your blood. And lastly, you could do what we call an obstetric, or when is the best time to get pregnant? When is the best time to get pregnant? Ovulation date. In this video today, we are going to talk about the best time to get pregnant. If you are a woman out there and you are looking at getting pregnant faster, then this video is for you. You are going to learn about the ovulation date, and by the end of this video, you will know when the best time is to get pregnant. Gerard Massa, the health educator, is the name of the channel, and we are going to talk about when is the best time to get pregnant. So the first thing we need to point out is that to get pregnant faster, you need to understand your ovulation calendar. You need to understand your ovulation date. We are talking about when is the best time to get pregnant. After this short message, please don't leave. Keep watching. We are going to talk about when is the best time to get pregnant. Thank you, my friend, for staying around. We are talking about when is the best time to get pregnant. Gerard Massa, the health educator, is the name of this channel, and on this channel we talk about the ovulation calendar, we talk about pregnancy tips, we talk about women health, including ultrasound scans. If you are new here, I welcome you, my friend, and remember to subscribe, click the subscribe button. Also hit the bell for notifications so that you do not miss any videos we put out. We release videos every day at exactly 17 hours. So when we talk about the best time to get pregnant, we need to understand first of all how your cycle is. The normal menstrual cycle ranges from 21 days to 35 days. So if you have a 28-day cycle and you see your periods on the first day, the second, and then on the third, this is basically an example. You could be a woman who goes into your periods for maybe 6 days, but we are taking a 28-day cycle. When you see your periods on this date and then the second and the third, then to get your ovulation date, the best thing you need to do is you begin counting from the first day, then count up to the 14th day. The 14th day highlighted here is when you are supposed to be ovulating. And when we talk about ovulation, simply we are talking about that period when an egg is being released. The time when an egg is being released from your follicles, from your ovaries, that is what we call the ovulation date. And specifically, you just have to count the days you are in your periods. Do not mind about the rest of the days. Just count beginning from the first day and then count 14 days. And when you count 14 days, it means you are supposed to be ovulating around this period. When is the best time to get pregnant? The best time to get pregnant is that period when you are ovulating. Do not leave. We are going to talk about this in detail. The most important thing we need to note is that when ovulation happens, there are many changes which will take place in your body. The first change is that there's going to be an increase of hormones. The hormones we are talking about here include the follicle stimulating hormone and then the luteinizing hormone. Although there are other hormones like progesterone and then estrogen or estradiol, but the most important hormones we are talking about here include follicle stimulating hormone and then luteinizing hormone. When the time for ovulation reaches, what is going to happen is that these hormones are going to be released from the anterior pituitary gland, and then when they are released, they will go to your ovaries. Your ovaries are also known as gonads, and then these two hormones are going to stimulate your ovaries to release the egg. They are going to stimulate the ovaries to release the egg, and when the egg has been released, it's going to go to that particular part of your fallopian tube known as the fimbria, and then it will hang around there for only 12 to 24 hours. When the mature egg has been released, and then it is in the fallopian tubes and it has not yet been fertilized, after 12 to 24 hours, exactly after 24 hours when fertilization has not taken place, what is going to happen is that it is going to disintegrate, it's going to disappear. So when is the best time to get pregnant? The best time to get pregnant is when you are ovulating. And then also we should take this very important point that if at all you would like to increase your chances of getting pregnant, there are 3 key things you need to put in mind. The first is that you should be having a healthy egg. Your ovaries should be functioning very well. When we talk about the ovaries functioning very well, they should be able to put you through ovulation. You should be ovulating very well. Of course, to ovulate, it means your ovaries are working very well. The other thing is that there should be a healthy sperm. Healthy sperm means the sperms or the sperms from your husband should be healthy in such a way that the quality and the quantity should be within the normal ranges. If your husband has poor quality sperms, or if your husband has issues with his sperm analysis, then you realize that even though you ovulate, getting pregnant may become difficult. So if you are a couple and you have tried to get pregnant but really things are not working out for you, or you have tried but you've done all the tests, or you've taken all the medications and maybe you've not done the tests, then this video is for you. The most important things you need to take from this video, from this lesson for today, is that for you to get pregnant much more faster, number one, you should be having what we call healthy sperm. That is, the husband should be having a healthy sperm. To know whether your husband, or if you are a husband to your wife to know if you have healthy sperm. The most important test you need to do is what we call the semen analysis test, whereby a sample of your semen will be taken. Your laboratory technician will tell you on how to collect the sample. So after collecting the sample will be analyzed in the lab, and then the spermatozoa or your sperms will be analyzed on motility, that is how they move, and then the structure, how they appear. If at all they are sperms but they are lacking, probably maybe they are lacking some parts like the tails, they are lacking some key parts, then you realize that if the sperms are missing the tails, then motility or movement will be impaired. They will move very slowly. The other thing is that the sperm is made up of 3 key things. It is made up of the head, and then the neck, and then also the tail. So if at all on the head there is low acrosome. Acrosome is that chemical which is actually on the head. It is the chemical which is actually released when the sperm meets the egg, and then it basically wants to penetrate. The acrosome is like what? It's like the gatekeeper. It opens the gate. It's the one which knocks the shell of the egg so that the real nucleus penetrates and then does the fertilization. So if your sperms are lacking the acrosome, then you realize that still they may not be able to even knock through the egg. They may hang around the egg on top until they die off due to the environment of the surrounding fallopian tubes. So in this video we are talking about when is the best time to get pregnant and the ovulation date. We've talked about the ovulation date and we have answered that this is the 14th day from the first day you saw your periods. If you are new here, I welcome you, my friend, and please remember to subscribe for new videos about women health, new videos about reproductive health. I welcome you, my friend. I'm so happy to have you here, and remember to come back tomorrow at exactly 17 hours. We release new videos every day about women health. If you have that question, that burning question, please go straight away in the comments and then post your question there, or submit your question. As soon as you submit it and as soon as I see it, I will answer. You can check through the comments. You can see how I have been answering our friends' questions, all the questions that have been asked. At least I'll try my level best to answer all your questions. Remember, getting pregnant is very, very easy. The most important thing is that you need to understand how your body is. If there's a deficiency or if there's something that is not right, you need to correct it. And then also you need to put God first, because we can give you all the education, we can advise you, we can tell you what we learned in school, but the most important thing is you as an individual, you as a couple, you need to put God first, because God can move mountains in our lives. Next point we are talking about is when is the best time to get pregnant, and we are saying that for you to get pregnant, the best time is on the ovulation date, and the ovulation date is the 14th day. It's the 14th day actually after from the first day you saw your periods. We have talked about the hormones that are really responsible, or the hormones which play a big part in ovulation. And these two hormones we have said include the follicle stimulating hormone and then the luteinizing hormone. We said that the follicle stimulating hormone is released by the anterior pituitary gland. This is also stimulated by the hypothalamus, which is just above it. The hypothalamus releases a hormone known as the gonadotropin releasing hormone, and then this gonadotropin releasing hormone goes to the anterior, or it signals to the anterior pituitary gland to release the gonadotropins. These are the follicle stimulating hormone. You'll see your doctor will write for you on a request that you go and test for FSH and LH. Normally when your doctor writes this, it means they want to assess the levels of these two hormones we are talking about here. So when the anterior pituitary gland releases the FSH and LH, these two hormones go and they stimulate your ovaries. Now the issue is, if you have tried to get pregnant, you are ovulating, you have all the normal signs, your periods are regular, but still getting pregnant is really difficult, then it means there could be a problem. It means your anterior pituitary gland could be stimulating. It could actually be producing the two hormones, that is FSH and LH, but when they reach your ovaries, they are not doing their function. Maybe on the ovaries, there are issues on the ovaries. There could be issues like maybe a presence of polycystic ovarian syndrome, also abbreviated as PCOS or PCOD, polycystic ovarian disease or polycystic ovarian syndrome. Polycystic ovarian syndrome is a condition where the ovary is filled with many cysts. Cysts are small growths or masses on your ovaries, and we call it polycystic ovarian syndrome because it is a disorder which actually affects the ovaries. It affects the normal functioning of the ovaries. How can you tell that you are ovulating? You can tell that you are ovulating by using the ovulation predictor kits, but also you could look at some key signs. For example, the discharge from your private parts, the discharge from your vagina is going to be sticky, it's going to be a lot, it's going to be increased, and then you'll feel the you'll feel the top of your cervix. It will go backwards, inwards, and then it will tend to open in preparation for creating space, for creating a way for the sperms to go through. And then of course you'll be having some body changes. For example, your breasts will become tender or they will be painful, and then also you'll feel like you'll be having what we call increased libido, or you'll be having increased sexual urge to be with your partner. These are normal changes which basically happen to signal to you that you are in your ovulation days. So if you are a woman and you have tried to get pregnant and you are ovulating but pregnancy is not happening, then it means you need to have yourself checked out. You need to be assessed for some key things. The first test you need to do is what we call the pelvic ultrasound scan. We call it the pelvic ultrasound scan because it is an ultrasound scan, or it is a check of your pelvic region, checking all the pelvic regions. And when we talk about the pelvic regions, we are talking about the two ovaries, assuming that you have the two ovaries. But even if you have one ovary, but as long as it is ovulating and your fallopian tubes are patent or they are open, they are not blocked, you can still get pregnant. So we say that for you to get pregnant very easily, you should be having the two ovaries, or you should be having an ovary with an open fallopian tube which is working very well. The next thing is that your ovaries should be normal. They should not be having issues like polycystic ovarian syndrome. But even if you have polycystic ovarian syndrome, still you can get pregnant. The most important thing is you need to master, or you need to look at your menstrual cycle and see how it has been moving, and then identify that period, that time when it is regular, and then also make sure that you consult your gynecologist so that they can guide you on which drugs they can put you on so that you ovulate well, and then you can get pregnant very easily. If you have polycystic ovarian syndrome, do not sit at home. Talk to your gynecologist. They will put you on some medications, and then they will advise you on how you can get pregnant faster. I have videos on this channel about how to get pregnant faster with polycystic ovarian syndrome. Please, after this video, you can go and watch that video. Still, it's among these videos on this channel. I welcome you, my friend. So we are talking about how you can tell that you are actually ovulating. We say that you can use the ovulation predictor kits. You can also look at your basal body temperature or basal body temperature. This is the temperature of your body, but normally this method, it involves charting for several days. You chart your body temperature at a specific time every day, and then you try to monitor. Normally during the time of ovulation, you are going to see a slight peak. There's going to be a slight increase, and then that slight increase normally is a signal that you have ovulated. So if you are looking at getting pregnant, it's not best to use the basal body temperature, though it can signal that you have ovulated. We are saying that it is not the best way to tell what to monitor to use to get pregnant, because by the time your body temperature rises, you would have already ovulated, And remember, when a mature egg, also known as a Graafian follicle, when it is released on the 14th day, it lasts for only 12 to 24 hours. So if at all it has been released for 12 to 24 hours, and then you actually maybe you realize that the temperature is rising and the egg was released like maybe yesterday, then the chances of getting pregnant will be decreased. The chances of getting pregnant are increased when you be with your partner, or when you have sex with your partner, with your husband, 2 to 3 days before ovulation. The main reason is that sperm survives for 4 to 5 days, assuming that your husband has sperm of good quality and quantity. This can be identified in a good lab, a good laboratory. You need to go with your husband, or he can go there and then he gets this sorted out, and then when the results come out that he could be having issues with his sperm count, then still treatment can be given. These treatments are available. Your doctor can recommend you the best treatments, and then also the best diet for increasing sperms can also be recommended. I have videos talking about this. Please go and watch those videos in the playlist. Yes, they are talking about how to increase sperm analysis or the sperm count. So we say that the best way to tell whether you are ovulating or when you are about to get pregnant is by using the ovulation predictor kits. The ovulation predictor kits, also abbreviated as the OPK kits, are available in all big pharmacies near you. They actually can also be ordered online. What is happening is that they look for the hormone known as luteinizing hormone and then estrogen. There are some new ones which look for the two hormones. So there are also other cheaper brands which look for only the luteinizing hormone, but it's best to get one which looks for the two hormones, because it can actually it can give us a clear picture that now this is the time of ovulation, and then you can be with your partner. And then also the other thing is that for you to realize that you are in your ovulation days, you need to really be ready. You should be able to manage issues that are happening. For example, if at all you'd like to increase your chances of getting pregnant faster and you are in a stressful situation, please, you should sort out the stressors, manage it, and then of course your chances of getting pregnant will be increased. So when is the best time to get pregnant? Ovulation date. We have talked about when is the best time to get pregnant. Gerard Massa, the Health Educator, is the name of the channel. I welcome you, my friend, to our channel. I'm really so happy to have you. Remember to subscribe, and then remember to talk to me. Remember to interact. I mean, talking, caring is sharing. It's really good that when you have this question that has been burning for a long time, that has been disturbing you for long about your health, please go down in the comments, ask me. You could also connect with me on my WhatsApp. My WhatsApp numbers are 2. That is +256 701 797876 +256 70. How to calculate ovulation for a Saturday cycle. In this video today, you are going to learn how to calculate your ovulation if your cycle runs for Saturdays. Gerard Massa, the Health Educator, is the name of the channel. Remember to subscribe for new videos we put out every day. Without further ado, the ovulation cycle for a Saturday calculation specifically begins with us having this example. We are taking an example of the month of August, and assuming you started your periods on 3rd, and then you saw your periods on 4th, and then you saw your periods on 5th. Let's say assume 3 days in your periods. If we want to calculate your ovulation date, or the date when you are most likely to get pregnant, the day when you are releasing a mature egg, also known as a Graafian follicle, let's say we have to begin counting from the first day you saw your periods. If you saw your periods on 3rd, you saw your periods sorry about that, if you saw your periods on 3rd and then 4th and 5th, we're just taking this as an example. It could be any other day. It could actually even be 2nd. So assuming you see your periods on 3rd, 4th and 5th, and you want to calculate your ovulation date, you simply get the first day you saw your periods, which is on 3rd, and then you count the few days you are going to be into your periods. But the counting has to begin from the first day when you saw your periods, and then you specifically count 14 days from the first day you saw your period. Remember, once again, we've said that you saw your periods on 3rd, you saw it on 4th, and then you saw it on 5th. So count 14 days beginning with the first day you saw your periods. So we shall say 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14. So the 14th day, which is actually, it's going to be a Sunday on 6th, on 16th, the 14th day is your date of ovulation. Specifically, this is the day when your hormones, that is luteinizing hormone and estrogen, are at their maximum. When we look at the ovulation calendar, you'll notice that during the 16th day, your hormone, that is the luteinizing hormone and the estrogen hormone, are at their peak. This is the date you are ovulating, and this is the date you are most likely to get pregnant, assuming when you have a 30-day cycle, assuming you spent 3 days. But if you spent 4 months, if you spent 4 days, let's say you started your periods on 2nd, still the same method applies. You have to begin counting from the first day you saw your periods, and that is, let's take an example of 2nd. You still say 1, 2, 3 those are the days you've spent in your periods. So to get your ovulation date, simply count 14 days, but strictly you have to begin from the first day you saw your periods. So we shall count and say 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14. So your ovulation date, or your date of ovulation, is going to be 15th. The formula is that you have to begin counting from the first day when you've seen your periods, then count 14 days. It doesn't matter where the date is going to fall, but you just have to count 14 days. If you saw your periods on 9th, still you just have to count 14 days, and we shall say 1, 2, 3, and then of course those are the days you are in your menses. We go back to the